81. Which of the following is an important environmental control measure for asthma patients? A. Use of humidifiers to increase indoor humidity levels. B. Regular cleaning to remove dust and allergens. C. Keeping windows open to ventilate the home. D. Keeping pets indoors to avoid dander exposure. Answer: B. Regular cleaning to remove dust and allergens. Rationale: regular cleaning helps reduce exposure to common asthma triggers, such as dust mites, pet dander, and mold. 82. How often should a patient with asthma perform peak flow monitoring? A. Once every month. B. Only during asthma exacerbations. C. Twice a day, every day, as part of their asthma management plan. D. Once every year during routine checkups. Answer: C. Twice a day, every day, as part of their asthma management plan. Rationale: regular peak flow monitoring, typically twice a day, helps track asthma control and detect early signs of exacerbation. 83. What should the nurse instruct the patient to do if their peak flow reading is in the yellow zone, 50 to 80% of personal best? A. Seek immediate medical attention. B. Take a quick relief inhaler and reassess in 15 minutes. C. Take their maintenance medication and wait for improvement. D. Continue with normal activities and monitor symptoms. Answer: B. Take a quick relief inhaler and reassess in 15 minutes. Rationale: a yellow zone reading indicates that the patient is at risk of an asthma attack, so they should take a quick relief inhaler and reassess their symptoms in 15 minutes. 84. Which of the following is a potential side effect of using a short-acting beta agonist frequently? A. Weight loss. B. Tachycardia and tremors. C. Increased mucus production. D. Decreased respiratory rate. Answer: B. Tachycardia and tremors. Rationale: frequent use of short-acting beta agonists can lead to side effects like tachycardia and tremors due to stimulation of beta receptors. 85. A nurse is teaching a patient how to use a metered-dose inhaler, MDI. What is the correct instruction for the patient? A. Exhale forcefully before inhaling the medication. B. Inhale quickly and deeply after releasing the medication. C. Hold the inhaler upright and shake it vigorously. D. Inhale deeply and hold the breath for 10 seconds. Answer: Deep inhale deeply and hold the breath for 10 seconds. Rationale: the correct technique involves inhaling deeply and holding the breath for 10 seconds to allow the medication to reach the lungs effectively. 86. Which of the following conditions is often confused with asthma due to similar symptoms? A. Chronic obstructive pulmonary disease, COPD. B. Tuberculosis. C. Pneumothorax. D. Pulmonary embolism. Answer: A. Chronic obstructive pulmonary disease, COPD. Rationale: COPD and asthma both cause wheezing, shortness of breath, and coughing, but they have different underlying pathophysiology and treatment approaches. 87. Which of the following actions is recommended when a patient with asthma is exposed to a known trigger? A. Increase the dose of maintenance medication immediately. B. Remove the trigger and use a quick relief inhaler. C. Take deep, slow breaths and rest. D. Delay medication until symptoms worsen. Answer: B. Remove the trigger and use a quick relief inhaler. Rationale: the first step is to remove the trigger if possible and use a quick relief inhaler to relieve bronchoconstriction and manage symptoms. 88. How can a nurse help a patient recognize early signs of an asthma exacerbation? A. Teach the patient to monitor peak flow readings regularly. B. Encourage the patient to wait until symptoms worsen before taking action. C. Advise the patient to only use medication when symptoms are severe. D. Instruct the patient to avoid using a peak flow meter. Answer: A. Teach the patient to monitor peak flow readings regularly. Rationale: monitoring peak flow readings helps patients identify early signs of worsening asthma, allowing for timely intervention and prevention of severe exacerbations. 89. Which of the following is a common trigger for asthma exacerbations in children? A. Exposure to cold air. B. Eating high-fat foods. C. Exposure to secondhand smoke. D. Engaging in intense physical activity. Answer: C. Exposure to secondhand smoke. Rationale: exposure to secondhand smoke is a well-established trigger for asthma exacerbations in children, exacerbating airway inflammation and narrowing. 90. Which of the following is the most important factor in preventing asthma exacerbations? A. Using medications as prescribed, even when asymptomatic. B. Restricting physical activity. C. Avoiding all allergens completely. D. Monitoring symptoms only when severe. Answer: A. Using medications as prescribed, even when asymptomatic. Rationale: consistent use of prescribed medications, including controller medications, is key to preventing asthma exacerbations and managing the disease effectively. 91. Which of the following is an early warning sign of an asthma exacerbation? A. Sudden, severe chest pain. B. Increased use of a quick-relief inhaler. C. Decreased heart rate. D. Increased appetite and weight gain. Answer: B. Increased use of a quick-relief inhaler. Rationale: increased use of a quick-relief inhaler indicates that asthma symptoms are worsening, signaling the need for early intervention. 92. Which of the following asthma medications is used to reduce airway inflammation over the long term? A. Montelukast. B. Albuterol. C. Fluticasone. D. Ipratropium. Answer: C. Fluticasone. Rationale: fluticasone is an inhaled corticosteroid used as a long-term medication to reduce airway inflammation and prevent asthma exacerbations. 93. A nurse is assessing a patient with asthma and finds a peak flow reading of 80% of their personal best. What action should the nurse take? A. Administer a quick-relief inhaler and reassess in 15 minutes. B. Monitor the patient and advise them to rest. C. Continue normal activities and avoid medication. D. Prepare for emergency intervention. Answer: A. Administer a quick-relief inhaler and reassess in 15 minutes. Rationale: a reading of 80% indicates that the patient is in the yellow zone, meaning they should use a quick-relief inhaler and reassess. 94. Which of the following is a common side effect of using an inhaled corticosteroid for asthma? A. Weight gain. B. Oral thrush. C. Tachycardia. D. Skin rash. Answer: B. Oral thrush. Rationale: oral thrush is a common side effect of inhaled corticosteroids due to their immune-suppressing effects in the mouth. Rinsing the mouth after use can help prevent this. 95. What should a nurse do when a patient with asthma shows signs of a life-threatening exacerbation? A. Administer additional doses of inhaled corticosteroids. B. Call for immediate emergency assistance and administer oxygen. C. Recommend that the patient rest and hydrate. D. Wait for the symptoms to resolve on their own. Answer: B. Call for immediate emergency assistance and administer oxygen. Rationale: a life-threatening exacerbation requires urgent medical intervention, including oxygen therapy and possibly advanced respiratory support. 96. Which of the following is an asthma trigger related to air pollution? A. Dust mites. B. Pollen. C. Ozone and fine particulate matter. D. Pet dander. Answer: C. Ozone and fine particulate matter. Rationale: air pollution, such as ozone and fine particulate matter, is a known asthma trigger, especially in urban areas. 97. A patient with asthma is prescribed a leukotriene modifier. What is the most likely purpose of this medication? A. To relieve acute bronchospasm. B. To prevent allergic reactions that exacerbate asthma. C. To reduce airway inflammation over time. D. To improve pulmonary function during an exacerbation. Answer: B. To prevent allergic reactions that exacerbate asthma. Rationale: leukotriene modifiers help control asthma by blocking substances that contribute to inflammation and allergic reactions. 98. Which of the following is the most important action a nurse should take during an asthma exacerbation? A. Provide patient education on environmental control. B. Administer a quick-relief inhaler as prescribed. C. Encourage the patient to engage in physical activity. D. Reassure the patient that symptoms will resolve without treatment. Answer: B. Administer a quick relief inhaler as prescribed. Rationale: administering a quick relief inhaler, such as albuterol, is the first line of treatment for acute asthma exacerbations. 99. Which of the following is a potential complication of untreated asthma? A. Sleep apnea. B. Pneumonia. C. Airway remodeling and chronic airflow limitation. D. Pulmonary embolism. Answer: C. Airway remodeling and chronic airflow limitation. Rationale: untreated asthma can lead to airway remodeling, causing long-term changes to the airways and permanent airflow limitation. 100. A patient with asthma is experiencing an acute attack after exposure to a cold, dry air environment. What is the first intervention? A. Encourage deep breathing and relaxation. B. Administer a short-acting beta-agonist, SABA. C. Give oral corticosteroids. D. Provide supplemental oxygen only. Answer: B. Administer a short-acting beta-agonist, SABA. Rationale: the first intervention during an acute asthma attack is to administer SABA, like albuterol, to relieve bronchoconstriction. 101. Which of the following is the primary mechanism by which inhaled corticosteroids work in asthma management? A. Relieving bronchoconstriction. B. Reducing airway inflammation. C. Dilating blood vessels in the lungs. D. Enhancing the clearance of mucus. Answer: B. Reducing airway inflammation. Rationale: inhaled corticosteroids reduce airway inflammation, helping to control asthma symptoms and prevent exacerbations. 102. A nurse is educating a patient on how to use a nebulizer. Which of the following is an essential step in using the device? A. Exhale fully before starting the nebulizer treatment. B. Take the medication immediately after starting the nebulizer. C. Inhale rapidly and hold the breath for 5 seconds. D. Avoid cleaning the nebulizer between treatments. Answer: A. Exhale fully before starting the nebulizer treatment. Rationale: exhaling fully before starting the nebulizer helps clear the lungs and allows the medication to reach the airways more effectively. 103. Which of the following factors is most likely to contribute to asthma exacerbations in elderly patients? A. Increased physical activity. B. Decreased medication adherence. C. Exposure to secondhand smoke. D. Decreased body temperature regulation. Answer: B. Decreased medication adherence. Rationale: decreased medication adherence is a common issue in elderly patients, which can lead to poorly controlled asthma and more frequent exacerbations. 104. What is the role of a long-acting beta-agonist, LABA, in asthma treatment? A. To provide quick relief of acute symptoms. B. To reduce the frequency of asthma exacerbations. C. To treat underlying infections contributing to asthma. D. To prevent allergic reactions that trigger asthma symptoms. Answer: B. To reduce the frequency of asthma exacerbations. Rationale: LABAs are used as long-term control medications to prevent asthma exacerbations by maintaining bronchodilation over time. 105. Which of the following interventions should be prioritized for a patient with asthma who is experiencing a severe exacerbation? A. Initiate corticosteroid therapy. B. Administer a short-acting beta-agonist. C. Reassure the patient and observe. D. Encourage deep breathing exercises. Answer: B. Administer a short-acting beta-agonist. Rationale: the priority in a severe asthma exacerbation is to administer a short-acting beta-agonist to quickly relieve bronchoconstriction. 106. What should a nurse assess when evaluating a patient's asthma control? A. Frequency of physical activity. B. The patient's peak flow measurements and symptoms. C. The number of missed workdays due to asthma. D. The presence of pneumonia. Answer: B. The patient's peak flow measurements and symptoms. Rationale: assessing peak flow and symptoms is essential for evaluating asthma control and determining if adjustments to the treatment plan are necessary. 107. A patient with asthma asks how they can avoid nighttime symptoms. What is the best advice? A. Limit the use of quick relief inhalers before bed. B. Sleep with the windows open for better ventilation. C. Elevate the head of the bed to reduce airway constriction. D. Use an inhaled corticosteroid daily as prescribed. Answer: D. Use an inhaled corticosteroid daily as prescribed. Rationale: consistent use of inhaled corticosteroids helps control airway inflammation, reducing the likelihood of nocturnal asthma symptoms. 108. A nurse is assessing a patient with asthma for signs of worsening condition. Which of the following would be a red flag? A. The patient is using their quick relief inhaler more than usual. B. The patient is experiencing occasional mild wheezing. C. The patient reports feeling generally well. D. The patient has normal peak flow readings. Answer: A. The patient is using their quick relief inhaler more than usual. Rationale: increased use of the quick relief inhaler is a sign that the patient's asthma is not well controlled and may be worsening. 109. Which of the following is a known asthma trigger related to exercise? A. Exposure to high-altitude environments. B. Airborne allergens like dust and pollen. C. Cold, dry air. D. Consumption of high-fat foods. Answer: C's cold, dry air. Rationale: exercise-induced asthma is often triggered by cold, dry air, which can irritate the airways and lead to bronchoconstriction. 110. What is a common first-line treatment for exercise-induced asthma? A. Oral corticosteroids. B. Short-acting beta-agonists taken before exercise. C. Long-acting beta-agonists. D. Inhaled antihistamines. Answer: B. Short-acting beta-agonists taken before exercise. Rationale: short-acting beta-agonists, such as albuterol, are commonly used before exercise to prevent bronchoconstriction and manage exercise-induced asthma. 111. What is the most appropriate action for a nurse if a patient with asthma is experiencing an exacerbation and their peak flow reading is below 50% of their personal best? A. Administer a long-acting beta-agonist. B. Give supplemental oxygen and seek immediate medical assistance. C. Administer a corticosteroid and monitor symptoms. D. Reassure the patient and wait for the symptoms to resolve. Answer: B. Give supplemental oxygen and seek immediate medical assistance. Rationale: a peak flow reading below 50% of the personal best indicates a severe exacerbation requiring immediate medical attention, including oxygen therapy. 112. A patient with asthma is using a metered-dose inhaler, MDI, with a spacer. What is the advantage of using the spacer? A. It reduces the dose of medication required. B. It helps to deliver the medication more effectively to the lungs. C. It prevents the inhaler from becoming clogged. D. It decreases the need for regular inhaler use. Answer: B. It helps to deliver the medication more effectively to the lungs. Rationale: using a spacer with an MDI ensures that the medication is delivered more effectively to the lungs, reducing the amount deposited in the mouth and throat. 113. What is a common environmental trigger for asthma in the home? A. Exposure to extreme temperatures. B. The presence of pet dander. C. Cold, dry air. D. Use of air purifiers. Answer: B. The presence of pet dander. Rationale: pet dander is a common indoor trigger for asthma exacerbations, especially for those who are allergic to animals. 114. Which of the following is an example of a long-acting controller medication for asthma? A. Ipratropium. B. Albuterol. C. Salmeterol. D. Montelukast. Answer: C. Salmeterol. Rationale: salmeterol is a long-acting beta-agonist, LABA, used for long-term control of asthma to prevent bronchoconstriction. 115. Which of the following is the most common symptom of asthma in children? A. Chest pain. B. Persistent coughing, especially at night. C. Fever. D. Weight loss. Answer: B. Persistent coughing, especially at night. Rationale: persistent nighttime coughing is a classic symptom of asthma in children, often due to airway inflammation and bronchoconstriction. 116. Which of the following statements is true regarding the use of inhaled corticosteroids in asthma management? A. They provide quick relief during asthma attacks. B. They are used to reduce airway inflammation over the long term. C. They should only be used during asthma exacerbations. D. They are not effective in preventing asthma symptoms. Answer. B. They are used to reduce airway inflammation over the long term. Rationale. Inhaled corticosteroids are long-term control medications that help reduce airway inflammation and prevent asthma symptoms over time. 117. A nurse is teaching a patient with asthma how to use a peak flow meter. What is the correct technique? A. Take a deep breath, then exhale forcefully into the meter. B. Exhale gently into the meter after a normal breath. C. Inhale through the meter, then exhale slowly. D. Inhale deeply, hold your breath, and then exhale forcefully. Answer. A. Take a deep breath, then exhale forcefully into the meter. Rationale. The correct technique is to take a deep breath and exhale forcefully into the peak flow meter to assess airway obstruction. 118. A patient with asthma is prescribed a leukotriene receptor antagonist. What is the primary purpose of this medication? A. To reduce inflammation in the airways. B. To relax bronchial smooth muscle. C. To block the effects of leukotrienes, reducing allergic responses. D. To prevent infections that can trigger asthma. Answer. C. To block the effects of leukotrienes, reducing allergic responses. Rationale. Leukotriene receptor antagonists block leukotrienes, which are involved in allergic reactions and airway inflammation in asthma. 119. What is the primary difference between asthma and chronic obstructive pulmonary disease, COPD? A. Asthma involves only the upper airways, while COPD affects the lungs. B. Asthma is reversible, whereas COPD is not fully reversible. C. COPD is triggered primarily by allergies, while asthma is not. D. Asthma primarily affects the alveoli, while COPD affects the bronchi. Answer. B. Asthma is reversible, whereas COPD is not fully reversible. Rationale. Asthma is characterized by reversible airway obstruction, while COPD involves progressive, irreversible airflow limitation. 120. A nurse is assessing a patient with asthma and notices a decrease in their peak flow readings. What is the first action the nurse should take? A. Administer a quick relief inhaler and monitor for improvement. B. Suggest that the patient increase their fluid intake. C. Recommend the patient rest and avoid all physical activity. D. Suggest that the patient stop using their medication. Answer. A. Administer a quick relief inhaler and monitor for improvement. Rationale. A decrease in peak flow readings indicates worsening asthma symptoms, so administering a quick relief inhaler is the first step. 121. Which of the following can be a non-pharmacological approach to managing asthma? A. Avoiding all physical activity. B. Reducing exposure to known environmental triggers. C. Using higher doses of quick relief inhalers. D. Taking antibiotics regularly. Answer. B. Reducing exposure to known environmental triggers. Rationale. One of the most effective non-pharmacological strategies for managing asthma is avoiding environmental triggers, such as allergens, smoke, and pollution. 122. What should the nurse monitor closely when a patient with asthma is using a long-acting beta-agonist, LABA? A. The patient's electrolyte levels. B. The patient's peak flow measurements. C. The frequency of quick relief inhaler use. D. The patient's blood pressure. Answer. C. The frequency of quick relief inhaler use. Rationale. Long-acting beta-agonists can mask symptoms of worsening asthma. The nurse should monitor for increased use of quick relief inhalers, which may indicate inadequate asthma control. 123. A patient with asthma is experiencing an exacerbation. Which of the following symptoms would be most concerning? A. Mild cough. B. Wheezing and difficulty speaking in full sentences. C. Mild shortness of breath. D. Feeling tired or fatigued. Answer. B. Wheezing and difficulty speaking in full sentences. Rationale. Difficulty speaking in full sentences and wheezing during an exacerbation indicates significant airway obstruction and requires immediate medical attention. 124. Which of the following is the best strategy for managing exercise-induced asthma? A. Avoiding all forms of exercise. B. Pretreatment with a short-acting beta-agonist before exercise. C. Engaging in exercise only during cooler weather. D. Increasing the intensity of physical activity gradually. Answer. Beat pretreatment with a short-acting beta agonist before exercise. Rationale. Pretreatment with a short-acting beta agonist before exercise can help prevent bronchoconstriction and manage exercise-induced asthma. 125. Which of the following is the most common cause of asthma exacerbations in children? A. Exercise. B. Exposure to allergens such as dust mites and pollen. C. Gastroesophageal reflux disease (GERD). D. Cold weather. Answer. B. Exposure to allergens such as dust mites and pollen. Rationale. Allergens, such as dust mites and pollen, are common asthma triggers in children and often lead to exacerbations. 126. What should be included in a patient's asthma action plan? A. A list of emergency medications only. B. Instructions on monitoring peak flow and recognizing signs of worsening asthma. C. A list of foods that should be avoided. D. Only the use of long-term control medications. Answer. B. Instructions on monitoring peak flow and recognizing signs of worsening asthma. Rationale. An asthma action plan includes instructions on monitoring peak flow, recognizing worsening symptoms, and using medications appropriately. 127. A nurse is educating a patient with asthma on the use of a dry powder inhaler, DPI. What is the correct technique for using the DPI? A. Shake the inhaler before use. B. Exhale fully before inhaling the medication. C. Inhale quickly and forcefully after releasing the medication. D. Hold the breath for 5 seconds after inhaling. Answer. B. Exhale fully before inhaling the medication. Rationale. Exhaling fully before using the DPI allows for better inhalation of the medication into the lungs. 128. A nurse is reviewing the medication regimen of a patient with asthma. Which of the following drugs is most likely to cause bronchodilation during an asthma attack? A. Prednisone. B. Fluticasone. C. Albuterol. D. Montelukast. Answer. C. Albuterol. Rationale. Albuterol is a short-acting beta agonist, SABA, that causes bronchodilation, providing rapid relief during an asthma attack. 129. What is a common side effect of oral corticosteroids used in the treatment of asthma? A. Hypoglycemia. B. Weight loss. C. Increased appetite and weight gain. D. Diarrhea. Answer. C. Increased appetite and weight gain. Rationale. Oral corticosteroids, such as prednisone, can cause side effects like increased appetite and weight gain, which should be monitored during treatment. 130. A nurse is assessing a patient's asthma and finds the patient has a forced expiratory volume, FEV1, of 75% of the predicted value. What does this indicate? A. Mild asthma. B. Severe asthma exacerbation. C. Normal pulmonary function. D. Moderate airflow limitation. Answer. D. Moderate airflow limitation. Rationale. An FEV1 of 75% indicates moderate airflow limitation, suggesting that asthma control may need adjustment. 131. A patient with asthma asks about the use of a spacer with their inhaler. What should the nurse explain? A. A spacer is unnecessary if the patient is using a dry powder inhaler. B. A spacer helps ensure more medication reaches the lungs. C. A spacer increases the dose of medication required. D. A spacer should be used only in emergency situations. Answer. B. A spacer helps ensure more medication reaches the lungs. Rationale. A spacer helps improve the delivery of medication from a meter-dose inhaler to the lungs, ensuring more effective treatment. 132. Which of the following would be the most appropriate action for a nurse if a patient's peak flow reading is in the red zone, below 50% of their personal best? A. Advise the patient to take a rest and drink fluids. B. Administer a quick relief inhaler and seek immediate medical assistance. C. Have the patient continue with their usual activities. D. Recommend an increased dose of a long-acting beta agonist. Answer. B. Administer a quick relief inhaler and seek immediate medical assistance. Rationale. A reading in the red zone indicates a severe exacerbation, requiring immediate intervention with a quick relief inhaler and urgent medical attention. 133. Which of the following statements is true about the role of leukotriene modifiers in asthma management? A. They provide immediate relief of acute symptoms. B. They are used to prevent bronchoconstriction by blocking leukotrienes. C. They increase airway inflammation to improve lung function. D. They can replace the use of inhaled corticosteroids for asthma control. Answer. B. They are used to prevent bronchoconstriction by blocking leukotrienes. Rationale. Leukotriene modifiers help prevent bronchoconstriction by blocking leukotrienes, which are involved in inflammation and allergic responses. 134. A patient with asthma is prescribed a combination inhaler containing both a corticosteroid and a long-acting beta agonist, LABA. What is the primary benefit of this combination? A. It increases the number of doses needed to control symptoms. B. It reduces the need for quick relief inhalers. C. It provides both anti-inflammatory and bronchodilatory effects. D. It prevents the patient from developing an asthma attack. Answer. C. It provides both anti-inflammatory and bronchodilatory effects. Rationale. A combination inhaler containing both a corticosteroid and a LABA provides both anti-inflammatory effects and bronchodilation, helping to control asthma symptoms and prevent exacerbations. 135. What is the most common trigger for asthma in the workplace? A. Excessive physical activity. B. Exposure to airborne irritants or allergens like dust or chemicals. C. Exposure to extreme weather conditions. D. Excessive caffeine intake. Answer. B. Exposure to airborne irritants or allergens like dust or chemicals. Rationale. Workplace asthma triggers include exposure to dust, chemicals, and other airborne irritants, which can exacerbate asthma symptoms. 136. What is the goal of asthma management with respect to long-term control medications? A. To provide quick relief of acute asthma symptoms. B. To reduce airway inflammation and prevent asthma attacks. C. To prevent the need for hospitalization during an asthma attack. D. To increase the frequency of peak flow measurements. Answer. B. To reduce airway inflammation and prevent asthma attacks. Rationale. The goal of long-term control medications like inhaled corticosteroids is to reduce airway inflammation and prevent asthma attacks over time. 137. A nurse is educating a patient with asthma about managing exercise-induced bronchoconstriction. Which of the following recommendations should the nurse make? A. Exercise during early morning or evening when air quality is optimal. B. Use a short-acting beta agonist inhaler before exercise. C. Engage in vigorous exercise to strengthen the respiratory muscles. D. Avoid exercise altogether if asthma symptoms are present. Answer. B. Use a short-acting beta agonist inhaler before exercise. Rationale. Pre-treating with a short-acting beta agonist, like albuterol, helps prevent exercise-induced bronchoconstriction by dilating the airways before exercise. 138. Which of the following is a potential side effect of using inhaled corticosteroids for asthma? A. Hypotension. B. Oral candidiasis thrush. C. Dehydration. D. Tachycardia. Answer. B. Oral candidiasis thrush. Rationale. Inhaled corticosteroids can cause oral candidiasis thrush due to the suppression of local immune function in the mouth. Rinsing the mouth after use can prevent this. 139. A patient with asthma asks how to properly use a metered dose inhaler, MDI, without a spacer. What is the correct technique? A. Exhale fully before using the inhaler and inhale deeply and slowly while pressing the inhaler. B. Exhale completely and then breathe in rapidly after pressing the inhaler. C. Press the inhaler before taking a deep breath. D. Inhale slowly through the inhaler without pressing the canister. Answer. A. Exhale fully before using the inhaler and inhale deeply and slowly while pressing the inhaler. Rationale. Exhaling fully and then inhaling deeply and slowly ensures that the medication reaches the lungs effectively. 140. Which of the following asthma medications is primarily used for quick relief during an acute asthma exacerbation? A. Salmeterol. B. Fluticasone. C. Albuterol. D. Montelukast. Answer: C. Albuterol. Rationale: albuterol is a short-acting beta agonist used for quick relief of acute asthma symptoms by bronchodilation during exacerbations. 141. A nurse is reviewing a patient's asthma action plan. What is the purpose of the action plan? A. To provide instructions for daily medication regimens. B. To outline steps to take during an asthma attack based on peak flow readings. C. To provide long-term treatment for asthma symptoms. D. To recommend alternative treatments for asthma management. Answer: B. To outline steps to take during an asthma attack based on peak flow readings. Rationale: an asthma action plan helps the patient manage asthma by outlining steps to take during an exacerbation, including peak flow monitoring and medication use. 142. Which of the following symptoms is most likely to indicate an asthma exacerbation in a patient? A. Mild, occasional wheezing. B. Difficulty breathing, inability to speak in full sentences and wheezing. C. Improved peak flow readings. D. Persistent feeling of fatigue. Answer: B. Difficulty breathing, inability to speak in full sentences and wheezing. Rationale: difficulty breathing, inability to speak in full sentences, and wheezing are signs of a severe asthma exacerbation that requires immediate attention. 143. Which of the following is a common risk factor for asthma in children? A. Exposure to secondhand smoke. B. Consuming a high-protein diet. C. Living in a rural environment. D. Regular participation in outdoor sports. Answer: A. Exposure to secondhand smoke. Rationale: exposure to secondhand smoke is a major risk factor for asthma in children, contributing to airway inflammation and asthma development. 144. A patient with asthma is receiving a dose of albuterol. What is the expected effect of this medication? A. Reduction of airway inflammation. B. Bronchodilation and relief of acute symptoms. C. Prevention of future asthma attacks. D. Increase in white blood cell count. Answer: B. Bronchodilation and relief of acute symptoms. Rationale: albuterol is a short-acting beta agonist that causes bronchodilation, providing quick relief from acute asthma symptoms. 145. A patient with asthma is being discharged from the hospital. What is the most important education point for the nurse to emphasize? A. Use inhaled corticosteroids only during asthma attacks. B. Always carry a quick relief inhaler and use it as prescribed. C. Avoid physical activity to prevent triggering asthma symptoms. D. Take all medications for a fixed duration and stop once symptoms improve. Answer: B. Always carry a quick relief inhaler and use it as prescribed. Rationale: it is crucial for patients to always carry a quick relief inhaler, e.g., albuterol, and use it as prescribed to manage acute symptoms of asthma. 146. Which of the following is a common asthma trigger during the winter months? A. High humidity. B. Cold, dry air. C. High pollen levels. D. Excessive heat indoors. Answer: B. Cold, dry air. Rationale: cold, dry air is a common asthma trigger during winter and can lead to bronchoconstriction and exacerbations. 147. A patient with asthma is having trouble using their inhaler properly. What should the nurse recommend? A. Use a nebulizer instead of an inhaler. B. Increase the dose of the inhaler for better results. C. Use a spacer to help with inhaler technique. D. Only use the inhaler during asthma attacks. Answer: C. Use a spacer to help with inhaler technique. Rationale: using a spacer can help improve the effectiveness of the inhaler by allowing more medication to reach the lungs. 148. What is the primary benefit of using a long-acting beta agonist, LABA, for asthma? A. It provides immediate relief of acute symptoms. B. It helps reduce airway inflammation over the long term. C. It prevents bronchoconstriction for an extended period. D. It treats underlying infections that trigger asthma. Answer: C. It prevents bronchoconstriction for an extended period. Rationale: LABAs provide long-lasting bronchodilation, helping to prevent bronchoconstriction and asthma exacerbations. 149. A nurse is assessing a patient's asthma control. What is the most important question to ask? A. How often do you exercise each week? B. Do you experience wheezing and shortness of breath frequently? C. What is your normal peak flow reading? D. Do you experience chest pain with asthma? Answer. B. Do you experience wheezing and shortness of breath frequently? Rationale. Frequent wheezing and shortness of breath indicate poorly controlled asthma and may require adjustments to the treatment plan. 150. A patient with asthma is being treated with oral corticosteroids for an exacerbation. What is an important side effect of long-term oral corticosteroid use? A. Hypotension. B. Hypoglycemia. C. Osteoporosis.
D. Anemia.
Answer. C. Osteoporosis. Rationale. Long-term use of oral corticosteroids can increase the risk of osteoporosis due to their effect on calcium metabolism and bone density. 151. A nurse is teaching a patient with asthma how to monitor their peak flow readings. What is the nurse's primary teaching point? A. Peak flow readings should be checked only during an asthma attack. B. A peak flow meter is used to assess the effectiveness of medication. C. Peak flow readings should be taken at least once a month. D. The peak flow meter is primarily used to diagnose asthma. Answer. B. A peak flow meter is used to assess the effectiveness of medication. Rationale. Peak flow readings are used to monitor asthma control and assess the effectiveness of medications over time. 152. What is the most likely cause of an asthma exacerbation in a patient who has recently been exposed to a viral upper respiratory infection (URI? A. Allergic reaction to environmental triggers. B. Increased airway inflammation due to viral infection. C. Overuse of long-acting beta agonists. D. A decrease in the patient's peak flow readings. Answer. B. Increased airway inflammation due to viral infection. Rationale. Viral infections, particularly URIs, can increase airway inflammation, leading to an asthma exacerbation. 153. What is the first-line medication for controlling chronic asthma symptoms and preventing exacerbations? A. Short-acting beta agonists, SABAs. B. Long-acting beta agonists, LABAs. C. Inhaled corticosteroids. D. Leukotriene receptor antagonists. Answer. C. Inhaled corticosteroids. Rationale. Inhaled corticosteroids are the first-line treatment for chronic asthma to reduce airway inflammation and prevent exacerbations. 154. A patient with asthma is concerned about their inhaler use. They ask about the potential side effects of using a steroid inhaler. What should the nurse include in the teaching? A. Long-term use of a steroid inhaler can cause weight loss. B. Steroid inhalers may cause oral thrush if not used correctly. C. Steroid inhalers increase the risk of developing a cold. D. Steroid inhalers are associated with insomnia. Answer. B. Steroid inhalers may cause oral thrush if not used correctly. Rationale. Oral thrush, candidiasis, is a common side effect of steroid inhalers. Patients should rinse their mouth after each use to reduce the risk. 155. A patient with asthma is experiencing a mild exacerbation. What is the most appropriate initial treatment? A. Administer a corticosteroid intravenously. B. Administer a short-acting beta agonist, SABA, like albuterol. C. Start a long-acting beta agonist, LABA. D. Administer antibiotics to prevent infection. Answer. B. Administer a short-acting beta agonist, SABA, like albuterol. Rationale. A short-acting beta agonist like albuterol provides quick relief during an asthma exacerbation by relaxing bronchial smooth muscle and improving airflow. 156. A nurse is caring for a patient with asthma and notes that their symptoms worsen at night. What might be contributing to this? A. Air pollution increases during nighttime hours. B. The body's natural circadian rhythms can affect asthma. C. Asthma symptoms only occur during the day. D. Nighttime medications are ineffective. Answer. B. The body's natural circadian rhythms can affect asthma. Rationale. Asthma symptoms can worsen at night due to changes in circadian rhythms, such as increased airway inflammation and bronchoconstriction during sleep. 157. A nurse is teaching a patient with asthma about environmental control strategies. Which of the following should the nurse recommend? A. Use humidifiers in the bedroom. B. Keep pets in the living room to avoid bedroom allergens. C. Avoid exposure to known triggers such as dust mites and mold. D. Keep windows open during peak pollen season. Answer. C. Avoid exposure to known triggers such as dust mites and mold. Rationale. Reducing exposure to known triggers such as dust mites, mold, and pet dander is key to controlling asthma symptoms. 158. Which of the following is a major difference between asthma and chronic obstructive pulmonary disease, COPD? A. Asthma typically involves reversible airway obstruction, while COPD involves irreversible airway damage. B. COPD is usually diagnosed in childhood, while asthma is more common in adults. C. Asthma causes alveolar damage, while COPD affects the bronchi. D. COPD responds better to short-acting beta agonists than asthma. Answer. A. Asthma typically involves reversible airway obstruction, while COPD involves irreversible airway damage. Rationale. Asthma is characterized by reversible airway obstruction, while COPD involves progressive, irreversible damage to the airways and lungs. 159. Which of the following medications is most effective for providing rapid relief during an asthma attack? A. Fluticasone. B. Salmeterol. C. Ipratropium. D. Albuterol. Answer. D. Albuterol. Rationale. Albuterol is a short-acting beta agonist that provides rapid relief during an asthma attack by causing bronchodilation. 160. A patient with asthma asks about the role of leukotriene modifiers in asthma management. What should the nurse explain? A. They help to open the airways during an asthma attack. B. They are used to block leukotrienes, which can contribute to inflammation. C. They are a first-line treatment for acute asthma exacerbations. D. They increase the frequency of asthma attacks. Answer. B. They are used to block leukotrienes, which can contribute to inflammation. Rationale. Leukotriene modifiers work by blocking leukotrienes, which are involved in airway inflammation and allergic responses, helping to manage chronic asthma.